So I'm so excited that everybody is here. So I'm just going to do quick introductions. I'm going to start with Dr. Christina Rahm. And I gave Doug a background about Dr. Christina and Christina a background about Doug. But Dr. Christina Rahm is our friend. She is a scientific formulator for Root Wellness. She's written books. She brings us great information and research every single week. And what I love is that she brings it to a level where everybody can understand, whether you are somebody that's new to this or a scientist working alongside of her. She brings all the best information, which I had sent a video to Doug. And what I love is that I timestamped some things because Doug is focused very much on fungus. And I'm like, okay, this is where you need to watch here, here, and here, because I know how busy we all are. This is Doug Kaufman. Doug has his own show. It's on Facebook. That's how I found him. And actually through his community is how I found Krista. That's how we became friends. And Doug believes in fungus until proven otherwise, which I love. So I actually knew Doug before I knew Dr. Christina. And I just knew that bringing you both together after hearing Dr. Christina, I was saying how the first time I heard you say fungus, I did a head spin and I was like, yes, I know somebody, I know a guy. So,
no, sorry, I don't want to interrupt you.
No, you're good. Go ahead.
I was just going to say, I trained under Rex and Rinaldi. They are two of the top doctors with fungus. And I did a lot of CME, a lot of training, and it was the autopsies of some of the things that I saw where literally there was, mushrooms growing out of the brain, and we would do the autopsy and we would see it everywhere. So I was in my 20s when I really started understanding fungus, and I'm still shocked to this day because, 50% of the people you find out in a morgue, they really have fungus. They go in with bacteria or viruses, but it's fungus. And I don't understand why doctors don't understand this. I really don't. Not to get off topic, but fungus has always been a hot topic for me personally as a scientist because there's such a lack of understanding. So
I watched your, an hour interview. And I sat there on the sofa the other night and my wife said, "What are you smiling about?" And I was smiling ear to ear. You're one of the few that get it. When I heard you talking about what we see, virtual mushrooms sometimes at autopsies, and yet the diagnosis is still bacterial.
Or viral.
Everything today is viral. It's very disconcerting. And yet you have to understand microbiology, the study of germs through medical training, this much education on bacteriology, this much on virology, and that much on mycology, the study of fungus. If it isn't vaginal yeast or ringworm, it isn't in their repertoire. And I think that's very unfortunate because mold yields mycotoxins, which are invisible subparticulate poisons that can be deposited in brain stem or the eyeball or the kneecap. And yet this isn't information that is dispensed during medical training. One day, I hope.
One day, I hope to.
One of the things I love that Doug does is that he advocates for those that are watching on how to speak to your doctor about fungus. How he actually has a sheet that you can print out and take to your doctor. But I often see in his comments about how I've gone to the doctor and I've asked for Sporanox or Diflucan, and the doctor doesn't want to prescribe it. He doesn't want, it's a lack of, I don't know if it's a lack of knowledge or a lack of just being able to admit that this could be the problem. And so one of the things I love about Dr. Christina is that her formulations are actually not only antibacterial and antiviral, but also antifungal. And she knows the importance of that. And so every time I see somebody say that to Doug, like, my doctor doesn't believe in it, he won't prescribe this, I go to, but there's a way, there's a solution, and you don't need a prescription for it.
No, but I have to be honest. I know most people don't like Diflucan. I do. I know that you could, thank you, Stephanie. Sorry, I needed a cough drop, so I was texting them to bring me a cough drop. I was traveling for 3 weeks. I know, but it's a cough drop. I was traveling for 3 weeks and didn't sleep a lot. But anyway, a lot of doctors don't like Diflucan because, going back to your point, they had this much education right, on fungus. And the IV formulations of most of the antifungals were so toxic before diflucan, fluconazole, you know, they were so toxic that people would die from the liver and kidneys and different problems from the antifungals. And then when Pfizer launched diflucan, people just never have caught up because the educational books in the medical school, and I taught oncologist, hematologist, and oh gosh, who else? Orthopedic surgeons, neurosurgeons at residency at Johns Hopkins. And it was funny, I was doing a talk and discussing the importance of this even during surgery, right? And what happens after surgery with wounds. And they're just, the main professor took me aside and said, you know, I don't think that's accurate and you can't talk about that. And so there's really, and this was 2014, I think. So there's really this lack of complete understanding. And so most of my formulas, Jill's right, I put in, like, even the bovine colostrum that I sourced. I sourced it with one of the main reasons I wanted to help with fungus throughout the body. And Restore and Relive Greens, they do that as well, and the Clean Slate. In fact, with the microscopes, when we did the clean slates, we sent them off to do third-party testing, and the fungus, it was able to rip apart the fungus. But fungus is so strong and so smart. And back to your point, just the little, it's nano-sized really, and they're in your body. It's kind of like cancer. You don't know where it is, you can't see it, but it's there and it grows. And so for me, this is a continuous thing. I try not to talk about it too much because I'm so passionate about it. But and you probably know this, parasites breed in the fungus. And so it's just, you know, I don't like fungus. And I really worked hard. Yeah.
I mean, good for you. You've come up with a solution. Traditionally, I introduced clinically for 26 years to various physicians, look, if your patient has psoriasis and it hasn't responded to Puvabox, UV light, or a cortisone shot in the hip, let's think outside of the box. So what I taught these doctors, one of them was out of Johns Hopkins, David Weekley was his name. What I taught them is, why don't we change these people's diet? Remember, grains, acid, greens, alkaline. Change their diet and give them fluconazole. I had no idea you were involved in that. So we'd give them a couple hundred milligrams of fluconazole a day, maybe 1 million units nystatin. These are people with psoriasis. Then we'd have them come back in 2 weeks. I always met with the doctors with them. David talked about putting Kleenex boxes in the rooms. When they'd come back, on occasion, people would break into tears. I have lived with this my whole life. Dr. Weekley, why didn't you come up with this before? I had seen this work in ENT clinics and internal medicine clinics. So I hypothesized at that time, 45 years ago, that maybe many medical health problems are driven by mold, mildew, and fungus. The Bible seems to think so. How about medical books? So I began to work in various clinical practices where the doctor said to me, don't get me in trouble, but I will prescribe off-label antifungals and will use your diet and we'll see what happens. I think the viewing public right now generally wouldn't understand this, but I think it's all due to a lack of an understanding in mycology. The two most important classes in medical training should be clinical nutrition, not only nutrition, but clinical nutrition and clinical mycology.
I love that.
I agree. I agree. You just have to get the rest of the world to agree.
Right. Exactly.
Which is hard.
It is. I've been doing this for so many years now. When I got back from Vietnam, I had all sorts of jungle rot and so forth. And my boss, Dr. Everett Hughes at USC Medical School, said, I told him I couldn't get in an elevator because I'm paranoid. My heart starts beating. And here I'm 21 years old. And he said one day, Doug, you ate raw fish in Vietnam? Yeah, on 2 occasions. I'll bet you have a parasite. So I went to the library. We didn't have a Hey Siri. You go to the library, you get a library card. And I pulled out an old 1953 parasitology book, just like you were saying. You're right. They're interwoven. Fungi parasitize man, just like nematodes do.
Yep.
And I got it. I totally began understanding. And I said, okay, well, what diet? And I put this diet together. What medication? I asked doctor if he would put me on nystatin. And at the time, like you said, the older generation, amphotericin B, griseofulvin. But we worry about these drugs back in the 1950s and 60s, inducing hepatotoxicity. They can blow your liver out. So along came diflucan, and terbinafine, some of these other drugs that didn't do that. They were absorbed in the bloodstream. So what I found is, look, I was introduced as the FUPO guy, fungus until proven otherwise. And guys, the cool thing about this is we can do this at home. You can change your diet without worry. Herbs, I love where you've gone. I love, somebody had to do this. Root structures, mycorrhizal, right? Root structures, antimicrobial in general. But we can, I heard you say on the tape, I was grinning ear to ear. I looked at resveratrol, I looked at cholecalciferol, vitamin D3, and I looked at antifungal. And so many people are going on, a folate or niacin, one of the B vitamins, and they're saying, I feel great. My blood pressure is stabilized with niacin. I'm feeling, without knowing that niacin is a potent antifungal. So what's really the root cause? And that's what I began digging into so many years ago.
Yeah, that's awesome. Yeah, niacin's really good. In fact, I'm drinking they just brought me greens because I drink greens 1 to 3 times a day. But the greens I have in here have a lot of niacin, and it's huge, to help in the body really do that. And we just launched the collagen colostrum, and Jill may have heard me yesterday. I think you were on there, Jill. Yes. I didn't get too much into it because I'm getting ready to do a series on it, because I've had so much criticism even before I launched this collagen colostrum as to why I was doing it, because they were like, well, you're vegan. And I'm like, I'm actually not vegan. And I said, I'm not against people being vegan. I used to be, but I said, collagen and colostrum are very important to me. And I brought up, here's one of the reasons this is important to me. And I did bring up fungus. And I said, this is a very powerful tool in the battle. And you want to provide as many blockades as you can. Again, because when I think of fungus, just like when I think of viral, viruses, bacteria, they're part of your body. But when they start overcoming your body, when they start really growing, they create cancer. Like, that's something no one wants to talk about, but they create all these autoimmune disorders, cancers, and of course, these skin disorders. And I worked for a company called Biogen Iodec for years. And I worked in oncology, I worked in neurology with multiple sclerosis and different things, but I spent a lot of time working in dermatology, and I did clinical trials in scleroderma, sarcoidosis, psoriasis, of course, pyoderma gangrenosum. And every time I would bring up, because we were using these human monoclonal antibodies that cost hundreds of $1,000s a year, and I would bring up, have we tried using diflucan? Have we tried using antifungals when it doesn't work? And they literally, I was well liked in the company, but they looked at me like I was crazy. Christina, why would we do that? I said, because I think if you can try every step possible before you're treating this with an IV infusion that's going to later have side effects, you should be trying these other things. But your dermatologist and immunologist are two of the top, smartest doctors in that profession, but they just wouldn't listen. And you would think, because they do the biopsies, and they do different tests on the psoriasis and eczema and everything else. But another issue with fungus, and I'm sure you know this, there's a false negative and false positive. So when they're testing, even today, you can't get an accurate reading. So one of the things I really want to do in my career is develop something to really help doctors understand fungus more and help them to diagnose it better, because they just don't acknowledge it. They leave it out. And so when you really understand the statistics, 50% of the people that are dying in this morgue, like I said earlier in this conversation, died from fungus, and not from a virus, even the current virus, right? I said this when this virus happened. I'm not concerned about the virus. We can deal with this. I'm concerned about the fungus and the parasites and everything else that are going to happen, because your fungus is going to breed in the body, and people will look around them, look at their homes, look everywhere else, because the virus is airborne. There's mold everywhere. And right away, within 3 months of the launch of that virus, there were 3 types of fungus that no one else had ever seen that came out, and they had to develop a different name for it. And I wasn't shocked at all. It just made me mad because no one's talking about it.
You see, your market is different from mine. After 50 years in this field, I initially went for the medical community. And I agree with you, there's got to be a way to quantify. I think some of the most common tests for fungus include the PSA. The PSA isn't prostate specific. It's made by 5 different ascomycete sac-forming yeasts. A cholesterol test. Statin drugs kill fungus. Before they were called statin drugs, they were antifungal drugs. They kill fungus. And oh, by the by, my triglycerides, my cholesterol go down. So this is what I put together, what I call the spore score. You'd probably laugh at this, Dr. Rahm, but
I actually want to see it. I'm very interested in that.
I'm going to send
I really
you
am.
a couple of books. I've just been blessed. I've written 13 books, and they continue to just fly off the shelves as this word gets out. I opted in about 1980, after my ENT work, I opted to go directly to the public. And I thought, even though I had given a few CME courses, I didn't see that as my market. They're never going to get it. They are beholden to the training they got during their medical training, which I respect. But the general public isn't benefiting from this. And so what I'm doing now, I have a television show of 23-year standings, and it's in 200 countries. And we're now, it's amazing what's happened in my life. I have decided to gently sidestep the doctor. I have asked people to go off grains for a short period of time, to try niacin, to try resveratrol, to try caprylic or lauric acid, you know, all of this, try herbs. And I'll be darned if the majority of them don't get back with me after a week or two and say, holy cow, could this have anything? I know, Doug, I wanted to talk to you about my skin problem or my migraines, but could this have anything to do with range of motion? Could this be mycotic arthritis and not rheumatoid arthritis the way it's been diagnosed? The public has taught me for 40 years that darn near everything can be linked to fungus. And yet, what are we getting in a doctor's office? Either an antiviral or an antibiotic. Antibiotics, penicillin is the mycotoxin. Penicillium is the mold. Mycotoxins induce, antibiotics are known to increase your risk of just about every cancer, and yet they're fungal mycotoxins. So, you know, I've come a long way from listening, not so much in medicine anymore. I subscribe to all the same newsletters that you do, MedPage and so forth. I don't learn a thing. I learn when I listen to the audience and they report back. This is exciting. My kids are now on this program and so forth. So good for you for doing what you're doing.
No, I love your, well, I can tell you're humble, honestly, and I like that a lot. And I can tell you've also worked very hard, and congratulations and thank you, because at least you're touching some people, because I feel like I talk about it a lot. I'm not sure people even listen. And another part that I just love that you said, when people take the different products I work on, which are designed to really get to this issue, you know, I bring up viruses and bacteria because people understand that. You bring up fungus and parasites, and, you know, my work in 86 countries, because I worked, they acknowledge that in places like Nigeria and Ghana. I know this sounds very odd. Malaysia, like I was just off the phone before we got in here with a large doctor group in 164 countries. Wow. That I was talking a little bit about this because I knew I was getting on the phone with you, and they understood, you know, to a certain extent. But in the United States, I don't, you know, I don't want people even taking an antibiotic unless they're taking an antifungal. That's how I feel. And honestly, some people need to take it the second or third day, like if they're on Zithromax or Levaquin or whatever, and then they need to take it again because their body is growing this. And you can even, if you look, and they were doing a autopsy at that point, they would see the white fungus throughout the body from the antibiotic. So anytime someone tells me they have a fever and they're not getting better, and I'm sure you know this, when you get pneumonia, you can end up having fungal pneumonia. You can have a fungal infection in your sinuses, but no one treats it. No one treats it. They'll even put you in the hospital on an IV antibiotic and no treatment, and then the person dies. I have so much, I don't want to use the word anger, frustration. And then my other frustration goes back to your point about diet. Because another thing I tell people is, listen, sugar and certain grains you're breeding fungus. And so when people tell me, for example, they're on my products, but maybe something's not completely right, my next question is always, what are you eating? And, they look at me like I'm crazy. And I'm like, look, you can't, it's kind of like you can't work out for an hour a day and then you eat whatever you want. You're not going to look great. Do you know what I mean? And so I love your incorporation of trying to explain that to people so they understand. And hopefully your TV show is really touching all these people so that they can educate other people. And they're going to have to educate the doctors, to be honest, because the doctors just I haven't been successful at getting most of the doctors that I've worked with to listen to me.
I am, I'll be 73 before too long, and I don't have a doctor. I don't know if my prostate is the size of a watermelon. I have no idea. I would assume not. But that's exactly my point. I watched mom and dad cigarette smoke, drink alcohol, live a life of fast foods when they came out. And at that time, all I knew was genetics. Today we have epigenetics that says, Doug, that sperm and egg became you, but that doesn't mean the hand dealt to you is the one you're going to pass on to your kids. So I began doing something in the 1970s, very bizarre. When I got back from Vietnam, I bought a pair of kids' running shoes. Now, $5.99. I began running, doing the opposite of what mom and dad were doing. I read an old book by Elizabeth Moore Landacker, a mycologist, Dr. Elizabeth Moore Landacker. In that book, she said, fungi alter the pH of mediums they grow in. And I kind of blew that off. Okay, that's fascinating. But wait a minute, we're a medium. If fungi grows in me, my urine, my saliva, my breath is very bad because I'm very acid. And truly, disease thrives in an acid environment. What are we doing in America? Drinking alkaline water. Wait a minute, why don't we address what the antibiotics did, like you so brilliantly state, what the antibiotics did in the gut to cause me to become so acid?
Right.
Oh, yeah.
Wow.
They have a hard time admitting that, I think.
I agree. So my dad actually died of Alzheimer's, but actually I believe that he died of fungus. So he had all we went to dermat. This is well before I knew what I know now. Root wasn't around. I had no idea who anybody was. I hadn't even met Doug at the time. So, but there was a lot of candida and yeast, and his skin was so bad. And I would go to the dermatologist, and it was never an antifungal. Looking back, it was always an antibiotic and a steroid cream. And now we're feeding the fungus. And so it is something that people need the education. And I love that you're both advocating sort of around the doctor to make sure that people have the knowledge that they need to understand this before it's too late. And if doctors won't get on board, then there's a way to do it without a doctor, to do it naturally. And it's actually better naturally, less side effects.
Well, Jill, we're having to wait for a doctor to give us a diagnosis. Let me tell you about a fascinating study, and I'll keep it short, done a few years ago. 21 cadavers. This is published in a medical journal. 21 cadavers, 5 Spanish pathologists go into the room, and the principals say, we want you to examine these cadavers and tell us of anything strange you see. And this is actually going to break your heart, and it just makes me so angry. I agree with Dr. Rahm. So they go and examine these patients. Well, 11 of them had excessive fungus growing in their brains and in other tissues. 10 of them had no fungus. all 11 died of Alzheimer's. None of the other 10 died of Alzheimer's. To you and I, that's a slam dunk, home run. And yet all research was just kind of dropped. I had some neurologists approach me about doing more work in this area. I've got to tell you that Alzheimer's, I believe, is a neurotoxic reaction that may have begun with antibiotics when these were young people, when your dad was young. If he was anything like me, he didn't wait till he was 20 years old to test another mycotoxin called beer, and then that plays a role in it. Antibiotics are mycotoxins. Alcohol is mycotoxins. And I think we all have a limit over which it becomes problematic, either neurologically or subclinically. We begin to have symptoms of depression. We can't see well, our joints hurt, we become obese, etc. And some people have too many neurotoxins. I am convinced today that cancer is being grossly overdiagnosed. Alzheimer's and other neurological, ALS, Parkinson's, which have been implicated with mycotoxins, fungal poisons. I am convinced today that we are hyper-diagnosing every medical malady because that's the way the big boys want it. A doctor, if you go to a doctor with 3 symptoms, you're not going to get the robotic. I always say, reach into the lab coat and start scribbling. You're not going to get 1. You have 3 problems. You therefore need 3 prescriptions. This is resocialization that takes place during medical training of our brightest and best. By the time they're out, they get an 8.5 by 11 piece of paper that most of them laminate. And if they're not good with that reaching into their right pocket, that piece of paper goes away and their ability to earn $300,000 to $700,000 a year. We got a problem, Houston.
Right.
We do. I was just trying to find something because I wanted to send it to you. I can't find it, but there's some articles I was reading when the vaccines happened too, because with vaccines, they know that the heavy metals and the carriers create this overgrowth of fungus, right? So that's why I was extremely concerned. And you're right, beer, alcohol, all of these things, sugar, they're causing it. And then when you add this basically supercharged energetic way of delivery system, I personally believe the depression, the anxiety, the schizophrenia, which was documented back in Wuhan in China when we were doing the studies, we were able to find that the bipolar and schizophrenia were like 70% higher with the different people that were, and so it's very concerning to me because I do believe these neurotoxins go to the brain. I actually was just working on toothpaste that we're going to launch later. This is a very interesting fact. So I work with labs, I work with manufacturers. So I actually had access to a study that talked about the fungus in the gums and in the parasites and Alzheimer's and dementia. And it showed kind of the same thing when they did the autopsies. There was parasites and fungus that started in the gums and then went to the brain. So I worked on these formulas. I added all these things. I went to the manufacturers, told them what to do. They ended up calling me back and saying, we don't need to add all these ingredients because that's not a real thing, fungus and parasites in the gums. So I had to send them the research articles that showed, they were in PubMed and NIH, and it actually was very conclusive data. They think that the parasites were growing, like I said, because they gravitate towards the fungus. So when the fungus went to the brain and these parasites did, and it really makes me sad because, my grandparents had Alzheimer's. Fungus in my family, when I was little, when I was born, and my sister and all of us, we've always had fungus. So I'm educated on this, right? So I'm always trying to fight this in my system. But so many people are uneducated. So many people wouldn't have to die from Alzheimer's and Parkinson's and dementia. And the American Alzheimer's Association actually issued some information that came out of Harvard that talks about the fact that Alzheimer's is not a natural part of aging. I worked at Pfizer when Aricept was launched, and Aricept really doesn't help a lot, right? It's supposed to be, you do the clock test, you do all of it, but And then I worked with a company out of Ireland, and we were trying to work on another monoclonal antibody for Alzheimer's. Again, it didn't work. The patients were dying. But yet we have these natural things we can give people that will help. And so the Alzheimer's Association did announce on their site that aloe vera, resveratrol, black cumin seed, a lot of these different things were helpful to the body. And it just so happens that those ingredients kill fungus. I literally, go to sleep at night, and I'll pray, and I'll ask, how can I get this information across? So it's really interesting to meet with you, because I'd love to do something where we can really help people, maybe more people will listen. Because if you can't get to the medical community, then you need to go directly to people.
I think that's a brilliant statement. I decided years ago to bypass, and you talk about praying. I mean, I had a tap on the shoulder from God to let the doctors give to Caesar what is Caesar's, let the doctors do what they're doing.
Yeah.
But Doug, I'm going to give you the ability to kind of clean up some of the debris that Mayo Clinic said on 9/9/99 that all chronic sinusitis was fungus. Today, all physicians write antibiotic prescriptions, not antifungals, for chronic sinusitis. How do you assure an acute first-time sinusitis doesn't become chronic? You pour an antibiotic on it, and that will make it chronic. That was opposite of what I was saying. How do you assure it's going to be chronic? You pour antibiotics on it. And that's what doctors are doing. And you know what, Dr. Rahm, God bless them. They have no idea. Here's what I ended my show with the other day. Father, forgive them, for they know not what they do. They are brilliant kids that are re-socialized during medical training to believe that grandma was a quack when she kissed your elbow and put a little, an herb on your elbow when you fell off your bike. It worked. You stopped crying, but I'll be darned, grandma was a quack. So it seems
she's ignorant.
Right. She's ignorant. She just didn't know.
No, really.
Right. What you needed was a new arm.
And
it's sad because I have a lot. I need to tell you, I have so many friends who are doctors. I love these people. Sometimes one of them will contact me regarding a lump in a daughter's breast or something, and we'll begin having this conversation. Do you know that ascomycete fungi, 75% of all identified fungi are ascomycete? They grow in a sac to prevent phagocytosis. That's interesting. How do I know if this is an ascomycete or a cancer tumor? You don't, unless you do a biopsy, send it off to a mycology lab. If I were a physician, I would split the sample. I'd send half of it off to oncology and half of it to mycology. And if you're visually seeing, you can now, thanks to this enhanced technology we have, you can see mycotoxins, aflatoxin growing in tissue in a breast. That's a pretty good sign. Why is Sporanox now being used successfully since 2016, the toenail fungus drug? Why is it being used successfully with so many cancers? Because I think cancer and fungus have a lot to do with one another. And so what I'm teaching people is, if your doctor won't give you the Sporanox, think outside of the box. You hit the nail on the head the other night when I was laughing ear to ear. Black cumin. Wow, is that antifungal? Resveratrol. Wow. So good for you doing what you're doing. I'm so pleased to be here with you.
Well, I'm pleased to be here with you. I don't know that I wish we could help more people, but I think that if we can keep educating, I have lots of slide decks that we've worked on that I want to present, and lots of articles I'm writing about this. And I can't believe you actually brought up 9/9/99, that they came out with this, because I'm very familiar with that. And, your infectious disease doctors that wrote that and came out with the research, they understand it. Can you imagine being at Mayo Clinic and Cleveland Clinic and being top doctors, and then no one listens to you? Right. No one adopts it. And I still remember training, like I said, with Rex and Ronaldo, and I was just shocked that these brilliant men that were well established, and people use these people as expert, no one was listening to them about the fungus. And they said most of the people will die because the doctors just won't treat them right. And I'm like you, my nephew's a doctor at Yale. My niece is a doctor in Charlotte. I have so many friends. I've got 2 doctors here from Slovenia. One's an orthopedic surgeon and one's a pediatrician. It's just not part of the education. But I will tell you, the 2 doctors that are here from another country, they're from Slovenia. And when I had this discussion, we actually talked a little bit about it last night, because I feel like, and Jill may correct me if I'm wrong, but I feel like I bring this up a lot, Jill. I try to bring it up, in different meetings about fungus, and when I do different talks. They understood. I even talked about autism and ADHD and how the mother passes, we always talk about the mother passes the heavy metals on, but also the fungus. And so I think if we can keep educating people, because even these brilliant people, you get indoctrined, like you said, you basically are, I don't want to use the word brainwashed, but you're taught this is how you're going to treat patients, and this is the history. And as a research scientist, I don't believe anything anyone says. I always research my own things and look at, well, I shouldn't say anyone. You know what I mean? I try to look into it afterwards.
Yep.
There probably won't be anything I look into with this conversation. I have to be honest. You brought up all the points you brought up. I'm familiar with to some extent. And it's been a mission of mine, having cancer, having a brain tumor. Jill heard me talk about this, having a spinal tumor where they said I couldn't have my child. And, one thing after another, it was very important to me to treat myself for fungus, because I understood that it was partially or fully related, not just to an epigenetic, not just to an inflammatory cascade, but also to fungus. And I never forget that. But it's hard for me to have discussions with people, for example, that have cancer. I actually have a meeting tomorrow with someone, and hopefully she'll listen to me. You can't, I say this all the time, you can't make someone want to live. You can't make someone listen to you. But I say this too, you're judged according to what you know. That's what I believe. That comes, I know, out of the Bible, but I believe my mom always said to me, Christina, the more you learn, the more you succeed, the more you do, then that means you owe everyone more. And that means that you are supposed to tell people about all of this, or else you will be judged for not helping people. So that never leaves me. I have this, I don't want to say guilt, but I have this responsibility to educate people. But at that point afterwards, you hope they listen. You can't make them listen. And so one of the things at Root that I say is we present the science facts, and then I say, listen, this is a wellness product. So if you don't believe anything I just told you about fungus or viruses or heavy metals, this is definitely something that can help your body, because some people don't even want to accept that this could be a possibility. It's almost like you're telling them there's an alien. And you're like, no, this is just fungus. But it is hard. So I'm sure you've been extremely busy. And I know you speaking about this and having a television show and going all over and educating people has saved so many people's lives. I mean, I know that for a fact.
You get those testimonials. For the past couple of years, I just handed someone here. I'm telling you, I almost come to tears when I do my live shows, which I'm doing one in an hour or so here, because someone will write in, I don't ask for testimonials, that my dad came to see you with some horrible health problem 20 years ago when you were at the hospital, and he's still alive, and I just think, look, this isn't me. I can't do this. I am living proof that God still uses wretches to get his work done. And I kind of stepped out of mainstream long ago when I realized even my own friends were robotic. And I'm taking my show directly to the public, and it's gone really, really well. And you're right, I'm doing what you're doing. I'm helping a lot of people by putting common sense back into science. It's sad what's happened. I think the last 2 years, our eyes have been open to some of the fallacies, to some of how we have defined science really meant. And there are a lot of people that are opening. Look, I'm off to LA here in a couple of days, and I don't think my plane's going to take off from Dallas. And Are we now opening our eyes? Why isn't our plane going to take off? Well, they say there's not enough pilots. What happened to the pilots? They were here 2 years ago. Well, it's just not enough ground people, not enough flight attendants, not enough, something happened to all these people. I'm not proposing they're dead. Some of them had a choice to make. And they said, I'm not going to take that choice. So they left the field. No wonder we're seeing this going. I got on the phone the other day. My license came back wrong. I applied for it, came back wrong. There's some errors. I have tried for 2 weeks to contact DMV. They don't answer. They don't want to talk to you. So the other day I got my little hot rod and drove over there, and a very nice guy met me double masked at the door. And he said, you can't go in there. Well, I went in there 4 years ago. No, you can't go in now. We're concerned. And I said, okay, I'll give you that. But look at my license. Here it is. The one you just sent me. And here's my other one. The point is, there's only 6 people. There used to be 54 people working in there. There's only 6. Where have all these people gone? When Ruth and I drive from here to Austin every week, 250 miles, you can't get on the road because of all the trucks. I heard the trucks were gone. Nothing makes sense to me. I'm living in a world that is so diametric to what I grew up in. And I think that what's happening from this, you guys, the good news, if there's anything good, this COVID has been the saddest, sickest thing I've ever seen. If anything good has come of it, it's that we, the people, are beginning to question science. They're beginning to use that T word, trust. Do I trust what my pediatrician is doing? Do I want my 2-month-old to be vaccinated against a virus known not to kill them? Are there adjuvants in the injection that may react adversely to my children? We can't tell you that because that's proprietary, and we're making billions of dollars by not letting that information out. This world is very strange to me. We're all going to go home one day, but I just wish I wasn't seeing what's happening to America right under our eyes.
Right.
It's sad. It's hard.
Boy, there's a nice note to land it on, right? Now that we're all crying.
Yeah. So Dr. Christina is going to be on His Glory following our conversation, and Pastor Dave has done wonders for his ministry, and he has people in his ministry that are healing, like you, just unbelievable healing. I can't wait to see today's show as well. So I don't know if that's something that we can arrange. Maybe Dr. Christina can come on your show, and maybe you can join forces and get the word out to people. We would be happy to send you all the information on her formulation so that you can take a look at the ingredients, how they work, all the things.
I like it.
Yeah.
I do.
Samples, we can send you, we'll send that out to you. That's not a problem.
Did I get the name right? Root
Wellness, yes.
Root Wellness. That's
the Root brands.
The root cause.
Yeah. Yes.
That's really brilliant. Yes, if you could get that to me, I'd love that.
Yes.
And I wouldn't mind at all having her come on television and be seen by, at least a dozen new friends. The television show has done very, very well. And
now he sounds like Clayton, his 6 followers.
Yeah, both my followers.
Well, and I got to tell you, I'd love to have you on my show. We stopped it. I was doing this show called Scientifically Beautiful, but we did it with another group. And then after it ended, they asked me to do another season, but we have so many more followers than they did that I said, no, I want to do it on my own. And then they wouldn't let me. I had to sit out for like 6 weeks because I never even read what they signed. Our company signed it, but we will be starting by the end of the summer now, the series. And I'd love to have you on. Would love to have you on.
Listen, it's such a God thing. It's such a blessing to meet you. I mean, when I was grinning ear to ear for an hour last night, this has all come to fruition. We've met for a purpose. You two are so important in making that happen. Thank you so much for putting us together. This is a genius. This is very exciting what you're doing.
Well, it's exciting what you're doing, and hopefully the 2 of us can touch more people. Because I think that if we could talk, usually I don't agree with people on everything, which is fine. I never agree with my husband on things, so it's okay. But I agreed with everything you said, and I think if the 2 of us talked about it, more people would listen. I was asked to actually meet twice with Simone Gold. She's leading, the American
Oh, yeah. I love
frontline
it.
doctors.
Yeah.
But I've ended up, the last 2 months I've been gone really from the United States. So we've rescheduled. And then I'm doing some stuff with some of the other main doctors in that group. And sometimes I agree, like I said, and sometimes I don't, which is fine. God doesn't say to us, we didn't always agree on everything, but I really resonated, just so you know, with everything you said. And I think your mission is so important. And another thing I'd love to talk to you about, Jill, the International Science Nutrition Society, I would love for us to put his books and different things on there so people throughout the world can read it. So we'll just keep in touch. We're doing a meeting in Cyprus where we're bringing in people from different countries, but I would love for them to hear from someone, not just me, because I've been saying this on the calls, but I did the formulas, and I really want someone that can really explain this fungus part to people so they understand.
I'd be happy to. It's such an honor, such a blessing. Thank you. It's a blessing for me too. I think synergy applies. I think there's power in numbers, especially when the two people are so like-minded. Yeah. Well, Stephanie Foltz came in. Actually, I was on the way in here because I was on that other call in another room, and she took me aside before I walked in. She said, "You're really going to like him. He's really neat." Oh, so, thank you, guys. Yeah. Thank you, everyone. I appreciate it so much. And Jill, thank you. Thank you all so much. God bless you.
Thank you. And we'll be in touch. Thank you so much.
God bless you guys.
Well done.
All right.
Thank you.
Great day.
Wow. That was awesome.